Have you ever been sent to the emergency room, looked around, and wondered, what is everything and what is going on? There are many parts of the hospital illustrated by TV, movies, and books. These are often false illusions about what the emergency room really looks like. Furthermore, the image of the ER is distorted by media, leaving you wondering what is going on there, as well as who works there and what is their role. There are three types of injuries that will get you sent to the ER. These three types of injuries are assessed, classified, and recorded by a triage staff. A triage staff is a team that creates the initial assessment of the patient, which enables the higher medical staff to make a decision about the care that needs to be received. The first is a minor injury. These injuries are non-urgent and can be wait to be seen. As these are things such as sore throat, respiratory infections, cold and flu. The second type of injury that will get you sent to the ER is intermediate injuries. These are injuries that can wait to be seen, but are more urgent than in beginning. The third is major injuries. Major injuries are injuries that require immediate medical attention because the person's health is deteriorating. These are conditions that such as anything that involves chest pain and severe trouble breathing, open wounds, if blood is flowing quickly out of the body, heart attack, stroke, fevers that are above 105, cranial problems such as hemorrhage and aneurysms, cancers, and coughing up blood. All of these injuries are subject to change due to the fluctuating conditions of the patient. So, how do you get to the hospital? The first option is you can drive yourself. The second is air support, often referred to as an air ambulance. This is used to transport patients who are too sick to be transported by land, usually because they live far away, such as a distance of 100 miles or more, and this is usually done with a flight crew that includes a pilot, a flight nurse, a flight physician, paramedic, and registered respiratory therapist. The third is an ambulance, which are manned by EMTs, which stand for Emergency Medical Transporter. They're first responders. This type of medical transport often works alongside firemen and policemen in emergency situations. So, who works in the ER? There are two types. So, there's the triage staff, which I mentioned before, but there are also nurses, which diagnose and coordinate with doctors with the interest of the patient in mind. There are trauma nurses and surgical nurses. Trauma nurses admit the patients to the ER, monitor vital signs, assist and coordinate with the doctor, and help stabilize the patient. Surgical nurses are the ones who work in the ER, that work in the emergency room. They care for the patient before, during, and after surgery. They serve as a communicator between the surgeon, the surgical team, and the family of the patient. They monitor the patient during surgery and maintain a sterile operating room environment. The second who helps with emergency injuries are the doctors. They fix the patient based on the diagnosis. There are two types. Trauma doctors, which assess the patient, do the paperwork, review notes, x-rays, lab results, CT scans, so on. They provide the standard of care, which means they provide the care necessary to diagnose or stabilize the patient. A second type is a trauma surgeon. They are responsible for doing a surgery based on a trauma doctor's observations of the patient, and they're responsible for follow-up care. There are many parts of the hospital illustrated by TV, movies, and books. They are often false illusions, and the ER is displayed in a bad light in the media. The people who work there are not like the doctors of Grey's Anatomy, and not every case is a dire emergency. Hopefully you learned in the speech what the emergency room is really like.